So many of our patients that we see at CCIM suffer from conditions such as brain fog or anxiety, depression, neuropathic pain, ADHD, sleep-wake cycle problems where people aren't sleepy at night, can be very awake at night and can't sleep. And we know that sleep dysfunction is a major hazard to how long we'll live and how well our life is. Chronic fatigue, chronic headaches. And our approach to this is to do the diagnostic workup, get to know the real underlying cause of symptoms. We'll figure out what people's neurotransmitter levels are like, what their microbiome is like. We know that microbiome dysfunction leads to inflammation, which can and does affect the brain. When that happens, people feel brain fog and fatigue and even memory problems, memory impairment. And the most advanced dysfunction at these levels can lead to dementia and degeneration of the brain itself, even strokes. Our approach is to lessen that inflammation, repair the microbiome, balance the hormones, which are really important for brain health. Even right now, every moment our brain is repairing itself at the neurologic level. Neurons use steroid hormones to repair themselves. And that's where we can be of service using endocrine treatments for traumatic brain injury, for memory problems, for dementias, and even see a measurable improvement in people's memory and thinking, even if they have a diagnosis of dementia. We have a 75-year-old woman who's had moderate to severe dementia that's significantly improved with our endocrinology program. And we have a lot of cases like that, and it's really amazing when people feel like my mind is the way it used to be. I can think clearly through problems, I can get my tasks done, I'm not procrastinating anymore, I'm able to function and relate to my family, my anxiety's better, my depression's better. That's just such an important thing. We relate to the world via our brain, and we can do a lot to help people if we lower inflammation, balance neurotransmitters, and balance hormones.
What does that look like for the patient once all said and done? How they feel?
Patients will tell us how they're feeling. We get feedback from patients over time, so that we know that we're moving in the right direction. Maybe some protocols need to be adjusted to better serve them. Continual customization is as part of the workflow, so that we find the right solutions for people. And when we won't stop until we do. Patients tell me, oh, pain's better. I can function during the day. I can go back to work. We had patients that were off of work on disability that were able to go back to work, and that's an amazing thing. Brain fog improves, memory improves, concentration improves, and the toolkit's pretty big. It's not just hormones and microbiome. We may need to use medications. It depends on each particular case. So the point is that we have a toolkit that is pretty big that we can use to find the right solution for each person. And when they're telling me that, oh yeah, I'm feeling better, I'm thinking clearer again, I'm able to sleep through the night, and when I wake up in the morning, I feel energized, then we can slowly back off on treatments and wean people off of them, because it's a sign that their inflammation levels are coming down. And repeat testing confirms that. And that's one of the great things, when we wean people off of treatments and they don't need us anymore. This is now a person whose inflammatory burden, the inflammation is less, and they're not in that cycle of chronic inflammation anymore. And they can just move on without being in that sick body, which is one of the best things of my life, is that I get to witness that in people. Nothing better than that.